Hi everyone, let's shift the discussion to surrogate decisions for incompetent patients. Let's start with the substituted judgment standard, and that is to make a decision the patient would have made if competent. And this just means that the patient never made a decision prior to becoming incompetent. So the surrogate is really basing their decision for that patient based on what they truly believe this patient would have valued as an appropriate decision for their care. The pure autonomy standard is when a surrogate makes a decision based on the patient's prior autonomous treatment preferences. So that means that the patient had made a decision. It was very specific. The treatments to start, withhold, were vocalized to the surrogate, and so they know exactly what they would have chosen in that situation. The best interest standard has to do when they make a decision based on current risks and benefits of various treatments, alternatives, and quality of life. This best interest standard is very specific to what is going on now with this patient. What are the risks and consequences involved with continued treatment? For example, is it going to cause severe debilitation? Is it going to give them some hope of some quality of life if the treatment is successful? So the surrogate needs to take into account a variety of factors for the patient, and a lot of times they do require several details from providers, and nurses, social workers, possibly involvement in an ethical committee. And so the best interest standard is truly a very collaborative approach to making the best decision for that patient.